Now on to the disease candidiasis. I have made quite a few slides on this problem because it has taken on major importance in the last couple of years, meaning that there's a great amount of patients who come in with this. So I've gone into quite a lot of detail. So what is the definition of candidiasis? It is the most common oral fungal infection. The etiology is usually the fungal bacteria Candida albicans and less frequently other fungal species. For example, Cruce, glabrata, tropicalis, parapsilosis, just to name a few. There are several types of predisposing factors. The local ones are poor oral hygiene, xerostomia, mucosal damage, dentures, and antibiotic mouthwashes. So as you can see here on the tongue, this thick covering, this is Candida. I'm just going to continue with the etiology of candidiasis. So the systemic predisposing factors are the following: broad spectrum antibiotics, steroids, immunosuppressive agents, radiation, HIV, hematological malignancies, neutropenia, iron-deficiency anemia, cellular immunodeficiency, and endocrine disorders. The clinical features of candidiasis are as follows. Candidiasis is classified as a primary infection when the lesions are exclusively on the oral and perioral areas. There are 5 clinical varieties of the primary type of infection. They're named pseudomembranous, erythematous, nodular, palatal papillary hyperplasia, and candida-associated lesions. For example, angular cheilitis, median rhomboid glossitis, and denture stomatitis, to name a few. The secondary infection is classified as when the lesions are part of a mucocutaneous disease. Now I'm going to go on in the next couple of slides and name the main forms of candidiasis that produce white lesions. They're going to be the pseudomembranous, the nodular, and the mucocutaneous candidiasis. So the first subtype of candidiasis, which is a primary infection, is the pseudomembranous. The definition for this is the most common form of candidiasis. Its clinical features are as follows. It's characterized by a local or general creamy white, elevated, removable spots or plaques. It's found on the bucca, the soft palate, the tongue, and the lips. The most common symptoms are burning sensations and an unpleasant taste. The second type of white plaque or white lesion candidiasis is the nodular type. The definition or the difference between these 3 that I'm going to mention is that this is the chronic form of candidiasis. And its clinical features are white, firm, raised, undetachable plaques. The third and final type of white lesion candidiasis is the mucocutaneous. It is a heterogeneous and rare group of clinical syndromes. The clinical features are chronic skin, nail, and mucosal lesions. They are associated with immunological defects. Clinically, the lesions are white, irremovable, multiple plaques. Now we're back to talking generally about candidiasis with the laboratory tests. We do cytology and tissue culture examinations, or in chronic cases, we will do a biopsy. The differential diagnosis is leukoplakia, hairy leukoplakia, white sponge nevus, lupus erythematosus, etc. The therapy or treatment for this is topical antifungal agents such as nystatin and systemic azoles such as fluconazole.